with type 2 diabetes, some of the signs and symptoms are very vague. The book went on to talk about how usually patients with type 2, their signs and symptoms are non-specific, and they can be actually attributed to other things or other diseases, or maybe just stress, because most of the signs and symptoms, they're really like non-specific to diabetes per se, and they don't really suffer from the polys that much, although they can, but they're very they don't present themselves as aggressively as they will in patients that suffer from type 1 diabetes. So some of the things that they might experience are headaches, fatigue, and lethargy, muscle cramps, and irritability. That's due to maybe being dehydrated and having electrolyte imbalances, but those things again can be caused by other things, so it's not always attributed to diabetes per se. One of the things that will probably make the physician or us nurses, want to, seek out and explore to see if it's diabetes is if they have a family history of it, or if they're obese and they're inactive. And some of the other symptoms that they may complain about are visual changes like blurry vision, and that's due to glucose-induced swelling within the eye structures, and that's when you get these certain complications like diabetic retinopathy. They may complain of numbness and tingling, and that's due to the neural tissue damage caused by the hyperglycemia. Some of the GI symptoms like nausea and vomiting, constipation or diarrhea, that's also attributed to the electrolyte imbalances and possibly dehydration. But these things a lot of people suffer from, so it's not always attributed to diabetes unless we begin to probe and further assess these patients and ask about their family history and their lifestyle habits. Then that will probably prompt us to explore possibilities of the patient having diabetes. That will conclude my part of this presentation, and thank you so much for your time.